orange color code, orange code. These pictures are orange code catheter. 16 French is used in males. So, and the postgraduate has insufflated this balloon using a normal saline. Please don't forget, that is a wrong method of insufflation. How will you inflate this balloon? The balloon should be inflated with the distilled water. Okay, don't forget this. It should be inflated with distilled water. This is a wrongly done procedure by the PG student. The patient came back after 45 days. You are unable to deflate because the normal saline has crystallized in this channel. Because of the crystallization, now I am unable to remove the catheter. Because I am unable to deflate, so I am unable to remove the catheter. What will you do now? Cut the Foleys and remove, overinflate the tube and rupture, under ultrasound guidance, puncture the balloon, push sodium bicarbonate inside. The ideal method is a recent question. See, whatever I'm putting 30 questions are all AIMS questions which are asked in the exam. So all these can get repeated for FMGE exam. So please go through these questions. Under ultrasound guidance, puncture the balloon. That is the answer for this question. Please don't forget, sixth question is, answer is under ultrasound guidance, puncture the balloon. And don't forget the Foley's catheter codes. Foley's catheter, the three important questions they'll ask you is, 14 French is for green, for girls. 14 French, green is for girls. 16 French, orange is for boys. Orange is for boys, green is for girls. 18 French is there, which is the biggest size, which is 18 French is red for transurethral resection of prostate irrigation purpose. So after transurethral resection, I have to irrigate, no, that should be. So catheter should be changed every maximum 1 month. Here the patient was not removed for 45 days. That is also another reason for getting crystallization. Patient came after 45 days and you are unable to remove. That is also actually the maximum period I can use the catheter is 15 to 30 days. Maximum you can use one Foley's catheter for 30 days. This is a second picture showing you silicone catheter. This is silicone catheter. Silicone catheter you can use for 90 days. Okay, this is rubber Foley's catheter. So most of you will see only this rubber catheter, which is latex rubber made, which can be changed at every maximum 30 days. So latex rubber catheter at 30 days and silicone catheter at 90 days. So don't forget the color codes: green, orange, red. Green for girls, orange for boys, red for TORP and irrigational purpose. After gastrectomy surgery by the chief, the CRRI is giving chance to suture the skin. The CRRI is suturing the skin by the following technique. This technique is called as what? What is the name of this technique? Simple question. This is horizontal mattress. Okay. So don't forget, if this is a skin cut wound, if I take this side and this side like this and put a suture like this, it's a simple suture. If I take deeply like this and deeply come out like this and come out superficially here and put a knot like this is called as vertical mattress. In the same level, this is vertical mattress. Vertical mattress is deeper tissue, going deeper. This is a picture showing you horizontally I'm going like this, and it is like horizontal mattress is also called as box sutures. Box appearance. See, it looks like a box suture. We used to call it locally as put a box suture for this guy because the skin is unhealthy. So when the skin is unhealthy, we use this horizontal mattress. When the skin is unhealthy, such cases like a necrotic skin or a damaged skin, we put a horizontal mattress suture. Don't forget horizontal mattress sutures. So you are on a CRRI assisting a gallbladder surgery. The senior resident asks you to take a retractor and retract the liver. You will select. Yes, all of you are correct. Absolutely correct. A is the correct answer. Horizontal mattress. Don't forget it. You are a CRRI assisting a gallbladder surgery. The senior resident asks you to take a retractor. Which will you select? Can you tell me each retractors? This is Deaver retractor. This is Mari's retractor. This is Langenbach retractor. So after the end of this class, I will share this PDF in my Telegram group. You can go through that in the Telegram group, Surgery Sixer. Okay. T-ME Surgery Sixer is a group. You can go and download this from